Welcome. This PowerPoint presentation will explain the use of remote monitoring technology in patients with ICDs. Learning objectives covered within the presentation will include defining remote monitoring and how it is implemented in the clinical use of ICDs, explaining why remote monitoring is an important implementation in patients with ICDs, explaining short and long-term effects on practice and client health resulting from remote monitoring, and discussing barriers to the implementation of remote monitoring and suggestions for improvement. There are several companies that use remote monitoring in their implanted heart devices today. One easy access and patient-friendly company I found during my research was Medtronic. The Medtronic website defines remote monitoring to patients as a way for your implanted heart device to communicate with your clinic or doctor using a small monitor. Remote monitoring works by a sensor monitoring and recording data and then transmitting that data to a server where it is stored and then able to be accessed by the physician or clinician. The data can be viewed on just about any smart device used today, such as a smartphone and tablet, as well as a computer. Remote monitoring allows the device to be able to monitor its own functioning and equipment and can detect things like when the device has a low battery, a lead becomes damaged or faulty, or if there is a disruption within the device's circuitry, allowing for proper alerts to be seen and taken care of by proper personnel. Remote monitoring measures and records essential patient data such as heart rate and blood pressure, which can be crucial indicators to changes in health status and allow for quicker intervention. Remote monitoring can detect cardiac events early, allowing for physicians to be alerted and intervene before a patient becomes critical. Physicians can access data at any time, reducing unnecessary patient visits to the office. This makes for more efficient use of the physician's time and practice while also cutting down costs to the patient for office visits. Remote monitoring records occurrences of arrhythmias or other events, thus potentially providing early warning of changes in cardiac status or safety issues, which can reduce visits to the emergency room and hospitalizations. The image shown, courtesy of EP Lab Digest, shows the evolution of how remote monitoring has changed the way ICDs transmit information and lower time for early detection. The top part of the image shows how the old process of ICDs used to require the patient every few months to place a device over their ICD, and then a transmitter sent the information to a server where the physician would view the information at a follow-up visit. Early detection was about 5 months worth of time with this method. This leaves plenty of time for a critical event to have happened, having a patient be led to hospitalization or worse. The bottom part of the image shows how remote monitoring is a hands-free method for the patient that gives the physician current information within minutes, allowing for events to be detected much earlier. Remote monitoring decreases emergent visits, which increases provider efficiency. This happens from remote monitoring alerting physicians of change in cardiac status or device malfunction, allowing for intervention in office, reducing emergency department visits. As reported in an article written by a physician named Slotweiner, patient-clinician communication improved and patients were more compliant with the scheduled in-person evaluations when required. This was made possible due to the ease of use and patient acceptance and confidence in the remote monitoring technology. Remote monitoring was shown to increase patient engagement from ease of use, leading to better adherence to treatment and overall improved outcomes. Remote monitoring decreased length of stay during hospitalizations due to earlier interventions preventing less critical states for patient, which also decreased risk of death due to earlier detection preventing a patient from becoming too critical. In Europe, a study was done called the EFFECT study, done over a 2-year period where patients were followed for at least 12 months, that proves patients with remote monitored devices experience decreased hospitalizations, decreased cardiovascular hospitalizations, decrease in death rates, and have less visits in person to their primary care providers as opposed to patients who do not use the remote monitored systems. The hyperlink provided will show the entire process of the study, as well as provide charts showing the resulted differences in patients with remote monitoring versus patients without remote monitoring. Some barriers to implementing remote access include implanting the device can be disturbing to a patient's body image, so they may opt not to have an ICD implanted. Impaired understanding of technology may cause a patient to incorrectly set up a transmitter at home if they are unable to understand the directions. Cost can also be a deterring factor because, as mentioned by Mofsowitz, insurance does not cover the entire recurring bill, and high deductible insurance plans make patients aware of this. Maintaining connection can also be another difficult issue for patients. Some reasons maintaining connection may not happen can be traveling without the device, not plugging in or unplugging the transmitter, or things such as loss of phone or cell phone service. Some recommendations for overcoming barriers to implementation include addressing device implantation. It is important to be educating patients, especially as nurses, on the nature of their illness and the necessity for the device and monitoring. For the technologically impaired, the implementation of plug-and-play devices coming into popularity have helped to eliminate the issue as reported by Mofsowitz. Cost can be offset by decreasing the number of in-office visits to the physician. Maintaining connectivity seems to be the largest issue at hand. My suggestion would be to make a transmitter that is more easily portable and able to connect to more sources for transmitting, as well as be able to store information while offline that can be uploaded when the device is reconnected.